Brad Williams, Frugal Finance, understanding Medicare coverage after retirement. When you retire, securing the right healthcare coverage becomes a priority. For individuals 65 and older, Medicare is the central focus of any health insurance discussion. As you approach this milestone, understanding how Medicare works and how to choose the best, most affordable coverage is crucial. Medicare offers various options, and many retirees wonder whether they need all four parts of Medicare. Some may choose to purchase Medigap insurance to cover services that traditionally Medicare doesn't address. Key points about Medicare. Medicare is available to those 65 or older and is crucial for managing healthcare costs. It consists of four parts, A, B, C, and D, and each covering different medical needs. Medigap plans offered by private companies cover expenses not addressed by Medicare. Medicare initial enrollment period spans 7 months, starting 3 months before your 65th birthday. Part A, hospital coverage. Medicare Part A covers care received in hospitals, skilled nursing facilities, nursing homes, excluding custodial care, hospice, and certain home health services. Part B, medical coverage. Part B covers services necessary for diagnosing and treating medical conditions, as well as preventative care like flu vaccination. It also includes physician services for both inpatient and outpatient care, as well as some outpatient prescription medications. Unlike Part A, Part B requires a monthly premium, a deductible, and coinsurance payments. Part C, Medicare Advantage. Medicare Advantage, or Part C, is an alternative offered through private insurance companies approved by Medicare. These plans often combine the benefits of Part A and Part B and may include additional coverage for vision, dental, hearing aids, and wellness programs. There are 5 types of Medicare Advantage plans: HMO, PPO, MSA, PFFS, and SNP. It's important to note that if you opt for a Medicare Advantage plan, typically do not need separate Medigap insurance. Prescription drug Part D, prescription drug coverage. Medicare Part D provides coverage for prescription medication. Each plan comes with its own formulary, a list of drugs it covers, often organized into tiers with varying costs. If you want prescription drugs coverage and don't have a Medicare Advantage plan that includes it, you will need to sign up for Part D. Medigap insurance. Medigap policies sold by private insurers help cover out-of-pocket costs like deductibles and coinsurance that are not covered by traditional Medicare. These plans, which come in 10 standardized options, do not cover prescription drugs, so you may still need Part D. Medigap's open enrollment period is a 6-month window that starts the month you turn 65 and enroll in the Part B. Outside this period, you may face higher premiums or be denied coverage. Since 2020, Medigap plans C and F are no longer available to new Medicare enrollees. If you're choosing between Medigap and Medicare Advantage, it's vital to consider your health needs and financial situation. Initial enrollment period. When you first become eligible for Medicare, you can enroll during a 7-month window beginning 3 months before your 65th birthday and ending 3 months after. If you miss this initial enrollment period, you may have to wait until the annual open enrollment period from January 1st to March 31st to enroll in Medicare for a start date of July 1st. Missing the initial period could also result in higher premiums. Special enrollment period. If you're covered by a group health plan from your employer or your spouse's employer when you turn 65, you may qualify for a special enrollment period. This allows you to delay enrollment without facing penalties. However, if your group coverage ends during your initial enrollment period, you will not qualify for the special enrollment period. Other enrollment periods. Each year, Medicare Advantage and Part D plans have an open enrollment period from October 15th to December 7th. Additionally, there's an annual Medicare Advantage open enrollment period from January 1st to March 31st, allowing for changes in coverage. Cost of Medicare. Many people qualify for Part A without paying premium, as they have paid Medicare taxes during their working years. However, Part B has a standard monthly premium, which will increase in 2025 to $185, up from $174.70 in 2024. Those with higher income levels will face higher premiums. The average premiums for Medicare Advantage plan in 2024 is projected at $18.23. Some plans may not charge any premiums. If you enroll in Part D, the monthly premium will vary based on the drugs you used and the plans you choose. The donut hole in drug coverage was eliminated in 2020, but a coverage gap remains for those who spend over $5,000 on prescription drugs in 2024. After reaching this amount, you'll pay 25% of the cost until your out-of-pocket spending reaches $8,000, at which point catastrophic coverage kicks in. In 2025, that level is maxed out at $2,000. The average Part D premium for 2024 is $53.95. Sorting through your options, choosing the right Medicare coverage can be overwhelming. Many people opt for Parts A, B, and D with the addition of Medigap coverage. Others choose Medicare Advantage instead of traditional coverage. If you select Medicare Advantage and need prescription drug coverage, ensure it's included in the plan. If you return to work after retirement, qualify for a group health plan, understand how it interacts with Medicare. Your employer's HR department can clarify how to prevent gaps or overlaps in your coverage. If you have retirement insurance from a former employer, verify what happens if you cancel it and later want to reinstate it. Medigap premiums vary based on policy type and location, ranging from as low as $50 to several $100s per month. Can I get Medicare if I don't qualify for Social Security? Yes, even if you aren't receiving Social Security benefits, you can still sign up for Medicare, but you'll have to pay premiums for both Part A and B. Contact Social Security at this number. Penalties for delaying enrollment. If you don't sign up for Medicare within your initial enrollment window, you may face permanent premium increases unless you qualify for a special enrollment period. Some people who are still working and covered by employer insurance may delay enrollment, but it's important to check your specific situation to avoid penalties. Do I need Medicare if I have private insurance? If you have private insurance and are still working, the need to enroll in Medicare depends on the specifics of your coverage. If you work for a company with fewer than 20 employees or have COBRA insurance, you should enroll in Medicare to avoid losing coverage. If your employer coverage continues past age 65, you may not need to sign up for Medicare immediately. Conclusion, navigating Medicare's options can be complex, but understanding your choices is key to selecting the right coverage. Visit Medicare.gov for helpful tools to compare plans based on your health needs. Be cautious when using external websites, as they may be influenced by healthcare providers. Additionally, review your Medicare coverage annually to ensure it remains the best fit for you. Check out the long list of videos I have available under the playlist Medicare Medi-Cal. Comment if you have any questions as it relates to Medicare, Medi-Cal, and understanding coverage after retirement. Brad Williams, Frugal Finance. Thanks for watching. Hope that helped. See you soon.